Hello, I'm Dr. Z. Paul Lorenc, a board-certified aesthetic plastic surgeon practicing on Park Avenue, Manhattan, in the middle of New York City. Welcome. Today's topic is, what is a blepharoplasty? A blepharoplasty is an operation correcting the hooding of the upper eyelids and also the excessive fat or excess skin of the lower eyelids. So a blepharoplasty can refer to either the upper or the lower eyelid. There are different techniques that can be utilized, but really the most advanced technique, especially when it comes to the lower eyelid, is really no visible scars where the incision is made on the inside of the eyelid, fat is removed, a laser is used to tighten the skin, and truly there is no visible scar. As far as the upper eyelid, it's a simple incision right in that natural crease. Because the incision is in that perfect crease, it's not a visible scar. Who's a candidate? Broad spectrum. Patients from their mid-30s, early 30s, all the way to 50s, 60s, 70s. It's really anyone who has hooding of the upper eyelids, where the skin rests on the eyelashes, and excess fat of the lower eyelids, or excess skin, or even a lot of wrinkles on the lower eyelids. Those patients are good candidates for a blepharoplasty. Is there pain with this type of a procedure? Just like any surgery, there is minimal pain. It's pain that's controlled with pain medication. We also prescribe Valium postoperatively when the recovery is comfortable. You should take some time off from work, usually 3 to 5 days, at which point you can resume full activity except for heavy exercise. So that's really pretty much about the recovery. Within 1 week, 3 to 5, 7 days, you're to the point that you can be back to work, you can go out to dinner, nobody knows that you had surgery, and of course, as far as exercise, that's closer to 2 weeks or 3 weeks. The appearance immediately after the surgery really depends on what is done. If I use a laser, there is redness on the lower eyelids. If I don't use a laser, there's very minimal black and blue. There's hardly any black and blue on the upper eyelids. The interesting thing about the upper eyelid incision is that the scar is closed with one suture that's woven within the skin. Once that's removed, it's truly not a visible scar. Speaking of scars, there are no scars on the lower eyelids because everything is done internally. And as far as the scar on the upper eyelid, it's hidden in that natural crease, therefore it's not visible. How long do the results last? Well, really the answer is for the rest of your life. It's very unlikely to undergo a secondary blepharoplasty. Possible, but very unlikely. And also because we have so many different modalities now, really energy-based devices, neurotoxins, fillers, and so forth, the likelihood of a secondary blepharoplasty is really close to zero. The cost varies different in different areas of the country, certainly, and even different areas of New York City. But the cost is anywhere between $7,500 and $10,000. And again, there are some additional costs, such as the cost of the facility that you're having the procedure done at and the cost of anesthesia. But that's the general cost for a blepharoplasty. I want to thank you for your time, and hopefully this information you found useful.